Good morning to all. My topic is clinical profile, treatment, and study of visual recovery pattern in lactational optic neuritis. No financial disclosure. Lactational optic neuritis is an enigmatic entity in which women develop optic neuritis within 1 to 12 months while breastfeeding their infants. Though this condition is frequently encountered in this southern part of India, its etiology remains obscure. There is no specific treatment for this mysterious disease. To evaluate the clinical profile, treatment, and visual recovery pattern of 6 cases of optic neuritis during lactation. So it is retrospective analysis over a period of 6 months from Jan to June 2019. All new cases of optic neuritis during lactation was included, and previous attacks of optic neuritis unrelated to postnatal period and any patients with retinal disease were excluded from the study. Documentation include age of the patient, history, duration of lactation, clinical presentation. For all 6 patients, thorough neuroophthalmic examination and ophthalmic examination were done. Systemic evaluation was done. Serological investigation and neuroimaging MRI brain with contrast were done for all 6 patients. Coming to the results and analysis, total of 6 cases, pregnancy history was uneventful. Out of 6, 1 patient had twin pregnancy, and delivery history was uneventful. Out of 6, 4 had normal term vaginal delivery and 2 had delivery by cesarean section. Coming to the results of analysis continue, age group at the time of presentation ranging from 21 to 30 years, between 21 to 25 years in 4 patients, 26 to 30 years in 2 patients, duration of lactation ranging from 3 to 12 months, in the age from 3 to 5 months in 2 patients and between 6 to 12 months in 4 patients. All patients presented with acute diminution of vision with mild pain, laterality unilateral in 5 cases, and in only 1 patient bilateral presentation is there. Visual acuity at the time of presentation ranging from 6:18 to hand movements, between 6:18 to 6:24 in 2 patients, 6:36 in 1, and less than 6:60 in 3 patients. On examination, people saw RAPD in 5 cases except in 1 which had bilateral affliction. Coloration was defective in 6 patients. Central field showed central scotoma in 4 patients, non-specific pattern in 1, which was not done in 1 patient. Fundus examination, which revealed hyperemic disc edema in 5 patients and normal fundus in 1 patient. Neurological examination was normal. There is no focal neurological deficit. Systemic examination was normal. Blood investigation was normal. Neuroimaging MRI brain with contrast was done, which showed thickening of optic nerve, optic neuritis with no evidence of demyelination. So coming to the treatment part and visual recovery pattern, all 6 patients were initially treated with B vitamins, both injectable and oral. Breastfeeding was stopped for all patients and observed for 1 week. Of 6 patients, 3 cases showed visual improvement after 1 week with vitamins alone. So they had been advised to continue the vitamins, and frequent follow-up was done in 2 weeks, 4 weeks, 6 weeks, 8 weeks, and 12 weeks. So they have showed almost a full visual recovery by the 6th week. Fundus optic atrophy. In other 3 patients, no visual improvement was noticed with vitamins alone after 1 week. Then they had been started on IV methylprednisolone injection followed by tapering was given. So out of 3, 2 patients showed full visual recovery by 6 weeks, and only 1 patient with bilateral presentation showed slow visual recovery by the 12th week. So coming to the discussion part, lactational optic neuritis can hardly be considered a specific entity unless the disease recurs during a subsequent period of lactation without underlying demyelinating disease. The clinical course of optic nerve affliction in our case series was similar to classic optic neuritis. So out of 6, 1 patient had bilateral affliction and other 5 had unilateral optic neuritis. The clinical history and laboratory findings of 6 patients showed the same findings. Neuroimaging showed thickening of optic nerves with no evidence of demyelination in 5 cases, and it was normal in 1 patient. So clinically, presumed diagnosis of lactational optic neuritis was made. Nutritional deficiency was probably the cause of optic neuritis in our case series. The immunological abnormalities and hormonal changes during pregnancy and lactation may contribute to the manifestation of optic neuritis during lactation. All cases are excellent prognosis and showed full visual recovery by the 6th week, except in 1 case which had bilateral optic neuritis, so visual recovery by the 12th week. So to conclude, the existence of lactational optic neuritis, however, is questioned as a separate entity of its own. Pregnancy appears to be an immune productive period, but postpartum period is immunological time for exacerbation of demyelinating or autoimmune diseases. These are my references. Thank you, sir.
Thank you, Dr. Jayasree.
Yes, sir.
Can I ask a question now?
Yeah, we have little more than a minute for questions. Dr. Jayasree, let me start. So nice presentation.
Thank you, sir.
Go through the literature and what did you find? This controversial entity of lactational optic neuritis, has it been described as having such an excellent prognosis, or they generally don't improve so much?
Usually, we have go through the previous articles, postpartum optic neuritis, Journal of Ophthalmology. So there they have mentioned their case series in 4 case series. Within 3 months of postpartum, they have that is the reporters. That is in their cases, previous and current history of multiple sclerosis, demyelinating history is there. But in our case series, there is no precipitating factors or there is no neurological signs of demyelination. And another case article in Graves and North's clinical and experimental ophthalmology. So there they have mentioned various periods of optic neuritis. But their case series, in one case, even the stoppage of breastfeeding itself, it's cause clinical improvement of optic neuritis. So they have mentioned any hormone related changes also may contribute. They have mentioned like that, sir. But overall prognosis is good.
Okay, so I would like to know, there's a question I would like to ask. Did you perform NMO or aquaporins 4 antibody test or MOG antibody test?
No, sir, we have not done because visual loss is not profound. And even with vitamins and steroids itself, visual improvement we have noticed. So we have not done, sir. So and another thing is only one case, only bilateral presentation is there.
Why do you think only one case is bilateral? If it has some immunological etiology and it's related to
in previously articles, they have mentioned most cases of during lactation is bilateral. But in our case series, it's only one case, sir. That thing I have not, I don't know.
Okay.
Did we check for the nutritional deficiencies, because you are saying that it is one of the main cause of optic neuritis? Was vitamin levels actually examined in your cases?
Okay, this is the limitation of study, sir. We have not done any blood investigation related to nutritional deficiency. Because it's a retrospective analysis.
No, but we have given vitamins without any nutritional deficiency, and we postulate that the deficiency is one of the main cause. So without
actually,
having the levels,
clinically, we presumed the diagnosis, sir. We are
Okay.
Okay. Thank you, Doctor.
Thank you.
Thank you so
Thank
much.
you, sir.
I think we should move on.
Yep.
Yes.
Thank you, sir.